Recording in progress.
Buenos días, buenas tardes.
Good morning, good afternoon. From the Latin American Center of Perinatology, Sexual and Reproductive Health of the Pan American Health Organization, we welcome you to this meeting. Before we start, let me tell you that our activity will have interpretation into Spanish, English, and Portuguese. You can choose the language you prefer. Please click on the globe that you'll find in the toolbar. There you can select the language you like. This activity will be recorded, so you will have it available later. You can find it on YouTube. As we start this activity officially, I wanted to introduce the next speaker, representative of the Neonatal Alliance, Dr. Pablo Duran, who will give us the welcome words. Thank you, Constanza. Good morning. Good afternoon, all of you. Welcome to this seminar on prematurity and the importance on family-centered care and the irrestrictive access of parents to the neonatal unit. In the name of Dr. Susan Sarruya, the director of CLAPS, Sexual and Reproductive Health in Bajo, we want to give you a warm welcome to this seminar. This seminar is organized jointly with the Neonatal Alliance for Latin America and the Caribbean, and with an extraordinary group of families, mothers, fathers of premature babies that have been working in the care of premature newborns in countries of the Americas. We are really very happy to welcome you all in this seminar where we are celebrating the month, the day and the week, the month of prematurity. We are all aware of the importance and the need of providing comprehensive care, including the people-centered care, centered in the newborns and their families. And very specifically in this year, this is a topic that has been prioritized. We have prioritized the importance of debating about the presence of the families in neonatal care units. It's a priority for us to convey this message to all the stakeholders involved in this process. We know that we are speaking of a right that enables us not just to implement the priority actions, but essentially it enables us to defend and to protect those primary rights that for newborns to stay by their families, that their families can co-participate in the care of a premature baby. So our team working in the coordination and planning of this webinar and with the commitment of the various stakeholders, both of PAHO and the other agencies that we'll mention later. Once again, we want to welcome you, and we hope that all those experiences, doubts, and proposals by the people participating in this webinar may contribute to raise awareness among the staff of intensive care unit, intensive neonatal care units, but also the decision makers, so that families may enjoy the right of taking care of their newborns and being by their side, and thus contribute to so that health, development, and well-being and specific actions like feeding and grooming and care may be a reality, so that we can all contribute, not just to strengthen and make these rights come true, but also specifically so that we can attain the targets and goals established both globally, regionally, and at a national level to provide the best care possible to each newborn girl or boy, so that they can survive, so that we can eliminate preventable deaths, so that they can thrive in the health, development, and well-being. And necessarily this goes hand in hand to the need to alter, to strengthen the enabling environments where care is given, so that these goals and targets may come true. So, without any further ado, I once again send you the greetings of the director of the Latin American Center for Perinatology. Dr. Sarui unfortunately had a last-minute commitment, so she couldn't participate, but I want to thank all the colleagues that are with us today, both from the audience and as panelists. All of them will contribute so that this will be really a moment of commitment as we express the wishes, the needs that we must agree upon in the countries in the region. Thank you. Thank you, Dr. Duran. So now let us start with our activity. I'm Constanza Sotoconti. I'm a neonatologist at the Latin American Center for Perinatology. And as Dr. Duran just said, the engagement of families is a key axis of interest for CLAP. And so we want to give space to those stakeholders, the families. There's nothing better than listening to the users and the clients' voices to improve practices, and giving the floor to the families is giving the floor to premature babies. So, without further ado, let us start with this conversation. I'd like to ask you about how important irrestrictive access is. How important is it for mothers and fathers to enter the neonatal care units with no restrictions whatsoever? I'd like to ask Leah of Canada. Leah belongs to the Canadian Foundation of Premature Babies. How important is restrictive access for families, Leah?
Thank you. I am a mom of
Muchas gracias.
28-weeker. And I just want to start by saying I don't think that it's important for families to have unrestricted access. I think it is vital, and it is the most ethical care that can be offered to families. We cannot ethically keep babies from the only home that they've ever known, and that's us, their moms, and expect there to be no consequences. We are not one-dimensional physical beings. We are hardwired for relationship and connection. And there are many scientific studies that demonstrate what we already know in our hearts as mothers. So I won't get into the science, but I will say that the best that I felt in NICU was when I had Tessa, my baby, on my chest. And she was supposed to be in my womb for another 12 weeks. And so post-birth, we want to recreate that of the womb experience, that I am her home. I am the first caregiver. If there's a partner, my husband was the other support. My family was the other support, and the supportive hands that were holding us all was the healthcare team, because the healthcare team are the transient figures in our babies' lives. We are with them for their whole life. We are the constant. We can detect the slightest change in their progress, in their days and their nights. And so I, as a mom, participated as much as I could in Tessa's care, contributing to her emotional and physical development. And so I wanted to share that she went home 2 weeks before her due date, and she was exclusively breastfeeding. And I believe this is because I was there with her, and that's why it is only ethical to give unrestricted access to families in NICU. Thank you so much for having me today and for allowing me to speak.
Muchísimas gracias, Lía, por esta respuesta.
Thanks a lot, Leah. Thank you for your answer. It is absolutely clear that it's an ethical thing, and somehow that first time that you put your baby against your skin is there's nothing better than that to recreate the experience in the baby's experience in the womb. So thank you. Leah just mentioned that the healthcare team is only transiently involved in the baby's care, but it is true that many of these babies have very long stays. So given that there's a lot of staff in the healthcare team, many of those actors are listening today, let me ask Miriam of the Mexican Association of Neonatology, what is the role that you would highlight in the healthcare team? What role would you like to highlight? Miriam? Miriam, you are muted. Yes, thank you. First of all, for us nurses, professional nurses, the most important thing is to include the family. I mean, the newborn's parents and all the interdisciplinary team. And with regards to the nurses, the key thing is the neonatal cardiorespiratory resuscitation, and it is also important to consider that we have to educate parents on a comprehensive how to provide a comprehensive care to their newborns. Sometimes it's a singleton, sometimes they are twins or even more babies. But in the case of the hospitalized newborn, they are exposed to the impact of the environment of intensive care units. So it's going to be very important to have nurses intervene because they're going to improve the newborn's conditions. They're going to engage their families in these cares.
Adelante, Miriam.
¿Sí me
Please,
escucha?
Miriam, can you hear me? Somebody asked me to start the video. As for nursing professional care for the newborn, it must be tailor-made, comprehensive, and family-centered. And nursing staff needs to have the knowledge, be it hands-off and hands-on. We must have the necessary skills so that with updated knowledge, we may provide appropriate care to the newborn, safe and quality care. Similar that newborns receive must also be adequate in quantity and quality. Furthermore, must be timely. Therefore, it is important that professionals be prepared as the main caregivers. We must likewise organize at nursing level all the care and use minimal interventions. It will be important to monitor environmental stress, particularly decreased light and noise in the neonatal ICUs. And skin-to-skin contact must be encouraged with the parents and organized posture. And in case any procedures should take place or invasive maneuvers, it will be important to use painkillers for pain or non-pharmacological measures such as sucrose and glucose or breastfeeding. For neonatal nursing staff, it is important to survey continuous care to the admitted newborn, because it is we who remain longer with the newborns and their families, and therefore we need all this scientific and technical knowledge. Continuous education will be essential for the evolution of the health disease process and is essential for interdisciplinary work. We will detect and prevent motor and psychological, cognitive and social disorders during the different development stages of the newborn. As neonatal nursing staff, it is important to assess development and intervene effectively throughout the comprehensive care provided to the newborn, provide alarm signals, create a favorable environment for the newborn, and also have all the nursing professionals be specialized to respond to the needs of the newborn and family and preserve their quality of life. Via the Mexican Neonatal Nursing Staff Association, we have continuous education programs focused on specialized neonatal care via Ibero-American national and regional conferences, symposia, workshops, and conferences at national and international level, apart from training the parents in partnership with other associations. Thank you for inviting me. I'm open to any questions. Thank you, Miriam.
maybe we should also speak of the within the family, because as Leah clearly said, even if the health staff and different players are long hours together with newborns, the family is what will remain throughout. So I want to ask Jessica from the Small Nuno Foundation in Mexico, what is the role you would like to highlight in the family? Hello, good morning. We are aware of different sorts of families. However, we will refer to family-focused care and as a nuclear family and not mother and child alone. We want to highlight the great support we had for our mental health, economic stability, and maybe one of the less mentioned factors in these spaces is parents. I cannot imagine the support that my husband was for me during those 40 days. We were always caring for our child, and it's the father who receives the news of the state of health of the spouse and the child, and on many occasions much must take decisions leading to life or death, and reporting the rest of the family about what is occurring is this reception of this new family member. He kept our faith up. And of course, sometimes the scenario was very terrible. And with his concrete thought, help me. In the case of Angelica, he held her hand while holding her before a storm. In the case of Isis, he accompanied her so she wasn't overprotected, because neurodiversity sometimes make it attractive. If the new nurses could open the doors, more fathers can visit the parents without being absent from work. There will be more couples together there, more fathers supporting, feeling proactive on the way home. But above all, you would have a greater probability that when reaching the home is still having a family, because that is necessary. Let us place our stake from the emotional accompaniment of the parents by the health staff. It's care for the newborn, so important in his development, the psyche, and others. We must train them, but make them present. Let's care for couples, so thus we will protect the right to life and families. Thank you, Jessica. You're very, very clear. We're always thinking of babies, and together with the postpartum person, the mother, sometimes there was a preterm birth that had a severe condition, but of course, as somebody else receiving the news, giving consent, and that is vital in care. Thank you so much, Jessica. Now, I would like to ask, ultimately, what is lacking for care to truly be family-centered, so that it is effectively family-centered? It would be very nice, perhaps, to hear representatives from different countries to realize if there are commonalities in our difficulties. I now hand the floor to Laura from the Preterm Family Network in Argentina. Please, Laura. Good afternoon. If we think of the challenges to effectively have family-focused care, parenting the rights of preterm babies, we must consider first access to information for the families. This is mandatory to convey a calm and trust and empower families in the care of a baby after discharge to the home. Second, as a family association, we have the challenge of conveying to the health staff that we are in the neonatal ICU, not to judge the work of others, but to know, collaborate, and participate in the care of our children. And third, and this is a question for the healthcare professionals, if you are aware of these benefits of unrestricted to the neonatal ICU for families at all times that are beneficial both for babies and families. As professionals, what is lacking in order to implement all this? What do you need from the other players, as for example, a family association, in order to carry this out? We know that families are low-cost nursing staff, as Dr. Laguia used to say. we really know our children, we will take them with us home. We must all understand that families are not a visit in the neonatal ICU. It's important to educate the families, and this is part of the interdisciplinary staff work. We must listen. They must listen to the families, listen to each other, what is happening to us, what are our doubts. We must form partnerships among families and healthcare professionals to guarantee the rights of preterm babies. Thank you. Thank you, Laura. You've been extremely clear in your message. And now I will repeat the question to Viviana. She is from Costa Rica, from Prema, Costa Rica, a country that is far from Argentina. Laura has just told us about different matters we ought to overcome. Now, Viviana, what is lacking so that we effectively have family-centered care? Good afternoon. I am a mother of a twin that survived a 28-week gestation, and as Laura and Constanza, we may be far geographically, but share the same challenges. I think that the most important thing is to shift the paradigm in the healthcare professionals so they don't consider families as visitors for their children and don't consider the neonatal patient as a hospital patient in general terms, because they shouldn't have those restrictions. There are many forms of care where the family can participate, and that cannot be replaced by the health care staff. And we must all work together towards the same goal. That is that each child born preterm survive, and not only that, that they may develop, families become empowered during the hospital stage. So the health staff must work hard so that the baby survives. But what will happen later? We must continue working in the follow-up and in that environment provided by the family that impacts on the effective relationship, mental health, and all the neural development that the child will require throughout childhood to develop appropriately. I think there are many players involved in these challenges, starting with government policies. We need leave due to paternity and maternity in these preterm babies if we want to even open the units to unrestricted visitors. The parents must be able to go and have no issues in their jobs, to be empowered together with the babies and participate actively in their care all the time possible. And for that, we need public policies and players at government level, but particularly paradigm shift. There is a lot of scientific evidence justifying the need to have the families there. Not only we, the babies need it. So I make the same question Laura made. What is lacking if we already have the scientific evidence and have the evidence in other countries to have this unrestricted access to families in our country? Thank you. Thank you, Viviana. Of course, in the day of prematurity, we want rights to reach in a fair way to all countries in the region. This meeting is important because we have very diverse places and agree. This is somehow giving a voice to the babies and their families. And now I have another question, and it can be a challenge for the health team, but what would you want from the parents to receive from the health team? I hand the floor to Paula from Small Giants in Misiones, Argentina. The floor is yours, Paula. Thank you, Constanza. Good afternoon, everybody. What is important when we are as a mother and in the work we do in our foundation. I was a mother of a preterm child for 3 months. During all that time, we had no information. We didn't have any empathy as required in the health area. We are mothers and fathers that do not necessarily understand what is happening. We become angry, we become sad, we have anxiety, And it's often hard for people to explain these technical matters, bearing in mind in our region that we have families from colonies in the rural areas and from different places in the region. We are in the border with Brazil and Paraguay, so empathy is extremely important in neonatology. We listen throughout to these different families that are currently with preterm children, and we all agree in empathy. We must understand that these parents must understand what is happening. They don't know what is that table, that medicine, that study, and we need to know and understand what is happening with our children.
Del 70% de estas familias que
70% of these families, and we surveyed all the neonatal care units in the region, we all agreed that there's a lack of empathy by the doctors and the nurses. Because sometimes we all feel, as mothers and fathers, that we don't feel that our questions may be considered incisive and that they bother, as we want to know about our babies. We can't breastfeed and we want to know what we can do. Sometimes we feel guilty because we can't breastfeed. We need empathy. We need to be explained why that needs to be the case and to be accompanied throughout the process. And especially, I think that the most important thing is that doctors should educate the families emotionally, and that would be very positive as we are discharged, and we will be more confident as we go home with our babies, so that we can continue to manage the baby. So empathy is absolutely needed. Thank you, Paula. Yes, I think that I would highlight that word, empathy. Now, let me ask the same. What would you like to receive from the healthcare team? Let me give the floor to Paola. The network of support to premature parents in Guatemala. Thank you. It's a real pleasure to be with you. The network of support of Guatemalan parents originated because we had an experience that was a game changer, and it was created with a dream to improve the comprehensive care that our premature babies receive and their families, not just in Guatemala, but in Latin America. At our association, we have 5 key principles that we always like to share with the healthcare professionals. The first is that as parents, we want more information before, during, and after our stay at the neonatal care unit. We know that knowledge is empowerment, and if we are empowered as parents, we'll be able to collaborate with the team taking care of our babies. The second action, we always highlight how important it is for all these families not to be seen as visits. The International Alliance for the Premature also conducted a survey in different sites in Latin America, we confirmed that most of us feel like a visit, and that makes people uncomfortable. We don't dare ask questions. Sometimes we don't even know how to approach our babies. We don't know what we are allowed to do and what we are not allowed to do. So we tend to sit in the corner as an observer rather than as an active player. We also wanted the families to receive care based on their needs. In our countries, it is very important for children to have all these medical services and complements that are needed for the therapy, but also we believe that parents need comfortable places promoting bonding, skin-to-skin contact, breastfeeding. All those things are very important. And among the last 2, it's very important for the parents to have emotional accompaniment by the healthcare team and by other parents, by their peers that may accompany them based on their own experience. And finally, so that they can help them leave the NICU with a long or medium-term follow-up plan, because we are all aware that your baby won't quit being a premature when discharged. So this has an emotional impact on our families in our learning, and so that key action is to enable parents to leave, to be discharged with a plan of action for follow-up. Thank you. So in addition to empathy that Paula mentioned, we add adapting the messages to be conveyed to the families based on each family's needs. And we must remember that prematurity does not disappear when you're discharged from an ICU, that you need to continue with a comprehensive care. Nelly from Ecuador, of the Association of Extreme Premature Babies in Ecuador. What would you like to highlight? What should mothers and fathers receive from the healthcare team? Thank you, Constanza. As Paola very wisely said, the International Alliance for the Premature had an opportunity this year to become better familiar with the needs of parents during the children's hospitalization. And there are three things that are very important. In our survey, we see that the proper places for parents need to be increased by the neonatology units. Imagine a mother that has just given birth in a very uncomfortable chair, waiting to see her baby, or not having where to breastfeed or to get the milk. And they need to be taught simple tasks such as the daily cleaning, changing the diapers, singing to the baby, touching the baby. These warm hands should be able to hold the baby's bodies. Shiatsu and massages. Shiatsu is very successful, and it reduces pain and hypersensitivity and helps gain weight. And that also strengthens the relation with the person touching the baby, that person that is full of love and cannot give it to their babies. As well as the mental health care professionals, we give the parents what they need, 100% of the cases, accompaniment to handle their emotions, working and mourning, and the rejection and lack of understanding by the rest of the family that may not understand what's going on, the guilt, feeling of guilt, but especially accepting what the healthcare staff says. Many of them hit that lack of confidence that the parents feel in their hearts. I think that from Prematuros Extremos Ecuador, we can contribute to this. Thank you. Thank you, Nelly. Absolutely. There's a lot of work on prematurity. We've already highlighted prematurity, adapting discourse to be so that it will be understandable, and considering the environment, making people feel at home at the maternity wards where newborns stay and where parents stay, because that has an extremely important impact on our mood. And something that Nelly mentioned, that had been mentioned earlier too, was mental health. We highlighted the importance of nurses as people who spend many hours by the babies, but also mental health care professionals that are very important, especially managing bereavement. So, and irrestricted access of mothers and fathers is very important, but there are many evidence-based practices. Breastfeeding. This is very painstaking both for the teams and the families. Breastfeeding is the first choice before any other feeding. Human milk for premature babies right after birth, with feeding them with colostrum so that they can be given colostrum right away. The irrestrictive access favors all these practices. Now, as to the skin-to-skin contact, I would like, well, Leah already mentioned this at the beginning, but I'd like to listen, Cynthia from Nicaragua, could you, as a mother, describe that first time that you had access to your baby's skin-to-skin contact? What was the most important thing for you experiencing that with your baby? I'm Cynthia Delgado of Nicaragua, and I wanted to share my experience as the mother of premature twins. In 2015, Nina and Celeste, two girls that weighed 1 kilo 80 and 1 kilo 180. Celeste died after 6 days after a gastroenterocolitis, and the most marvelous that I could feel was to feel the baby's warmth and odor. I felt useful as a mother because I was protecting and giving love, and my baby filled me with peace. My breasts were full of milk, so much so that I managed to donate mother's milk to other children. Mia didn't want to be in the incubator. She would cry every time I left her there. After almost 2 months, just a few days before being discharged, my second daughter died. But that incredible effort, holding her in my arms, led me to create with other parents our association in my hospital, together with other parents. And in my country, the hospitals implement the kangaroo method, preparing the parents and babies for discharge. I wanted to tell you about my experience. It was very enriching. It gave me strength to help other children. And it is very gratifying to see 3 to 4 year old toddlers breastfeeding. I think that that link, that liaison, originates at the time of the kangaroo method. So my name is Cynthia Delgado. Thank you. Thanks a lot, Cynthia, for your words. That's key. What you're saying is absolutely key, because you're being heard by many stakeholders in the healthcare team, and your words are all there's because we realize how important it is to accompany the families who are afraid, and so that they may have contact with the baby's skin. We must never forget that these are evidence-based facts. So I would ask Natalia from Medellin, Colombia, who will tell us about the benefits that go beyond the pure experience. Thank you. Thank you, Constanza. I'm so touched being here, sharing time with our family of IPREM, this group of premature babies families. I work not only are we speaking of work, but also friendship, because every time I hear them, I feel so moved. For me, as a Colombian pediatrician, it's wonderful to talk about the skin-to-skin contact. That is the basis of the kangaroo method that was created about over 40 years ago in Colombia. It was thanks to the hard work of the Kangaroo Foundation. More than 20 years of research have made it possible to show evidence that it's a very valuable method. And today it's recommended by WHO not only for the premature, but low birth weight babies from the moment they are born and throughout most of the time. In this short minute that I have left, let me tell you about the benefits of skin-to-skin contact, not just for babies, but also for the parents. For the baby, we clearly have a reduction of the mortality rates, of the nosocomial infection rates. They gain more weight, they regulate temperature better, and something very important, we were just told about stimulation. Well, the contact, skin contact is the best method to stimulate these babies at initial stages. It's the way they can be in a warm place as if they were in the mother's womb. That will favor neurodevelopment and sensorial development.
Beneficios para los
It
padres.
also has great benefits for the parents. Among them, we've mentioned how stressing it may be to be in a NUKI. 1 and 2 weeks. Paula told us she was 3 months there. So having a skin-to-skin contact, as Cynthia and many more mothers who spoke had, is allowing them to have a reduction of their anxiety and fear, make them participate in their children's cake. We must always recall parents are not visitors, they are an essential part of the work team. It is them, the parents, they are the main caregivers of their own children. And what is the best way of doing it, apart from skin-to-skin contact? Breastfeeding also increases in the mother with all the consequent benefits and prepares them not only to provide care within the NUKI, but also after discharge. So for my colleagues connected here and others who will see the transmission later, skin-to-skin contact, lack of separation, enabling the families to be with their children 24/7 is our duty as healthcare professionals. Thank you for allowing me to speak. Thank you, Natalia. And last, a question for a brief answer, if possible, to close this conversation, to Eunice from the Brazilian Association of Preterm Babies. Eunice, NGOs, specifically family groups, how can they serve as a guarantee to allow for the rights of preterm babies, skin-to-skin contact breastfeeding from the start, from time 1 after birth? Thank you, Constancia. Good afternoon, everybody. Thank you for allowing me to speak. We had very interesting presentations, and as parents of NGOs in our countries, observe first that the challenges are similar. In all countries, we face similar challenges to guarantee these rights, but we are a major link. We build bridges often among players, so public power, scientific societies, society in general, families, healthcare professionals, private enterprise, healthcare agencies play an essential role when trying to guarantee the rights of families, because the constant presence of the parents in the NUKI is one of the rights they have. The importance of the evidence is also clear, as Leah said when she spoke at first. It is unethical not to allow the parents to access, and it's a benefit for the whole life of the child. So I totally support all the initiatives brought forward by my colleagues to receive the families in the NUKI, increase awareness, and apart from training them technically, to increase awareness in the healthcare team, because we must encourage debates such as the one we're hosting right now, that is so important, and mainly joint construction with these players. Public policies must be built because this will be a legacy for the coming generations, and we're speaking of a significant part of the young generations that these preterm babies are. Thank you. Thank you so much. Due to time reasons, I will now hand the floor to Dr. Duran and must repeat that mothers and fathers are not visitors, they're true protagonists of the baby's cares and are the true hosts. Dr. Duran will close with a short presentation on behalf of the Neonatal Partnership or Alliance. Thank you. Thank you. I will now share my screen. I hope you can see it well. And once again, and most important, to thank Mia, Leah, Jessica, Paula, Paola, Nelly, Cynthia, Natalia, and Denise, because their voices have allowed us to hear newborns and families, mothers, fathers, and the spouses of all those people that have the babies without the necessary contact accompanying them, because we know that if the approach as posed by Leah, where the families open their hearts, we know that these voices and experiences, the comprehensive view of the family, and not as a dyad alone of mother and child, the challenge for accessing information, the fact that families are not visitors or patients, the newborns likewise, the importance of empathy, information, a comprehensive and kangaroo care. Well, all these challenges we must be approached and set the need to strengthen our capabilities, and that is only possible if we do it working together and in partnerships. We know that newborns and children in general are subjects with rights, with their needs and demands that will change throughout the different stages of life, and also according to the context, countries, populations, and realities there. And in the framework of the Convention of the Rights of Children, Article 9 manifestly states that the party states must care to ensure that the children are not separated from their parents. And this is not only in general terms, that is having the family participating in the care, but more specifically in this group, we're mentioning that is preterm newborns. We know we have reached many goals at global level in the care of newborns, but we still have many gaps to fill. The good news is that in general terms, over 80% of births in the world occur in healthcare centers. On average, this figure corresponds to Latin America and the Caribbean, but there we are above 90%. Anyhow, many newborns are born preterm, some of which are not born in healthcare centers. In the Americas, over 1.2 million births occur preterm, and the proportion is 1 of every 10. In an extreme way, prior to 28 weeks of gestation, a similar percentage between weeks 28 and 32. And we know this poses many needs for both the babies and their families, the COVID-19 pandemic. And you may recall how at the start we debated the need for babies. Well, we not only debated, we implemented this separation from mothers when we suspected COVID, but sometimes when we didn't. And this isn't something that only occurred throughout the pandemic. We know this pre-existed the pandemic and continues being a challenge today in many countries and services in the region. In WHO, we have a framework to provide quality care to preterm and small and diseased newborns. Quality of care is supported on two pillars: provision of care that is evidence-based with the best information practices, but also receiving care. And here, all the aspects mentioned by the mothers occur. Communication with the family must be effective, participatory, respectful, and protecting them, complying with rights, preserving the dignity, and providing emotional, psychological, and developmental support. So the best optimal care, medication, and equipment, of course, procedures such as early onset, immediate onset of skin to skin contact, breastfeeding. There are very few situations where this will not be allowed. Feeding the babies with human milk, even preterm babies. So all these procedures require this quality care. And as we said, it's not only practices, equipment, and medication, it's also skin to skin contact, kangaroo mother care in the according to PAHO guidelines and standards, WHO guidelines and standards. These are the first procedures we must provide. And as stated, this requires a broader view where the person, in this case newborns, in the framework of the families and communities, and equitable access that is centered on persons in the healthcare centers, requiring healthcare service delivery, health sector responses, but also health care at the social support level, the work to legislate and protect the maternity and paternity leaves. So what we just heard becomes a reality. Care regarding the home and the environment, well, all that is essential. And this requires approaching care in a comprehensive manner so that this becomes a successful experience. Care throughout pregnancy and even before, any specific procedures, prevention, mothers and newborns, nutrition, growth, the care for postnatal reproductive, the care, all that is essential. However, we need to strengthen networks, extend them, and this requires that we are constantly asking questions about how to manage this newborn and their family-centered care. What is the role of this person-centered care at the health service level, where the whole team, nursing staff, medical professionals, and so on, be involved and adhere to this sort of care, where the follow-up of newborns after they are discharged from maternities occur, that we have integrated healthcare centers in the home, the community, with a legislative framework and an intersectorial approach. And this leads me to frame this presentation on behalf of the whole team of the Latin American Caribbean Neonatal Alliance, where this alliance that has a mission in the region to promote the health of newborns in Latin America and the Caribbean in the framework of a continuous reproductive and mother-child health care process, promoting institutional initiatives, promoting policies and programs that are evidence-based with an emphasis on the vulnerable populations, of course. And the vulnerable populations are the preterm or premature newborns in some senses, but also all babies born in contexts where they are exposed to specific vulnerabilities, a rural population, a migrant population, a native population that is still exposed to many more risks and conditions that require the support and answer from all players. The Latin American Caribbean Neonatal Alliance includes all these organizations listed here. These are the logos, United Nations agencies, bilateral cooperation agencies, multilateral cooperation agencies such as USAID, civil society players such as the Kangaroo Foundation's PATH, NACER, the Mormon Church, National Alliances, the Ministry of Health of Colombia, the Kangaroo Mother Care Program in Dominican Republic, the Nursing Association Federation, the Midwives, the Colombian Association of Neonatology, the Latin American Association of Pediatrics. Well, many organizations that are committed with the care and health of newborns. But that extends the network requires instruments so that we provide information and communication.
Vuelvo un poco atrás porque este mapa que omití mencionar da
So
cuenta.
I go back because I didn't mention this map. Here we see all the countries in which at present we are listening to the voices of these organizations. There are groups, networks of premature babies, families that are working hard to make their voices heard and to increase the visibility of the integrated and comprehensive care engaging the families. So we believe that this family-centered care may be a reality and be based on the participation of the families, and that they get created and strengthened in all the countries, in all the areas, these networks, and it should exist. And from this alliance, the alliance is interested in opening new sectors and new alliances, partnerships in the country, so that this family-centered care may provide a comprehensive care, so that the outcomes obtained may become a reality in the region. There are partnerships like this in many countries in the region, and we hope that this approach may be strengthened and expanded, so that the care of premature newborns, so that the presence of the families won't be seen as visits and the premature babies as patients, but as subjects with their own rights. So that means that we have to respond to these challenges. That means responding to the rights of the newborns and their families that cannot be neglected. Responding to the inequalities implies identifying who must act, when they must act, and how they must act. So that implies moving forward and responding to the interventions that very often are fragmented in the structure and in the provision of care, in the healthcare services, in the facilities. It's up to all of us. It's responsibility of all of us. We are all accountable. We have a role to play. So building and strengthening the culture of rights, of quality, of dialogue, engagement, and co-responsibility is something that we must all aim at. That is why, in the name of the Neonatal Alliance for Latin America and the Caribbean, the Executive Committee, and all the associations that are part of the Alliance, we also wanted to add to this commemoration, and we want to accompany all the actors in the care of newborns and their families. Thank you. Thanks a lot, Dr. Duran. Thank you for your words. I once again wanted to thank the representatives of the families. I think that here we all commit ourselves, each of us in our role from the direct care of babies, and we're all in pursuance of the same targets. We send you our warmest greetings, and we hope we can meet each other again, working together. Goodbye.
Recording stopped.